Hello, and welcome to Health is the Key, the podcast that explores the health and wellness issues that matter to 1199 SEIU healthcare workers. I'm your host, Elizabeth Moore. In case you haven't heard, leading research institutes have named 2026 the Year of the Brain. And while the good news is that we're living longer, in the U.S. that's about age 81 for women, 76 for men, the not so good news is that brain function declines as we age. When that decline begins is not exactly known, but what is known is that taking steps now, whatever age you are, can help support healthy brain functioning. Joining us to discuss how to keep your brain performing at its best is Dr. Anna Hohler, who serves as Chair of Neurology at Westchester Hospital in Mount Kisco and Chief of Neurology at Phelps Hospital in Sleepy Hollow. Welcome to Health is the Key, Dr. Hohler.
Thank you so much for having me today.
So when we talk about how the brain develops and when decline begins, can you just give us a brief overview of how the brain develops?
Yes. And so with normal neurological development, we think about the traditional pediatric milestones. So things like ability to sit up, ability to crawl, ability to stand, run, etc. And then later on, we think about development of fine finger movements in terms of our ability to write, etc. In language development, we think about the noises that babbling noises eventually turning into words, words being strung together into sentences, and then complexity of vocabulary development over childhood into adolescence. And then we have some more sophisticated types of cognitive development that happen. So things like future planning, ability to shift sets, ability to manage multiple forms of information at the same time. Those types of things happen more in the late adolescent and in the 20s as well. So when we think about neuronal development, some of the more higher level frontal lobe functioning as well, such as things like delayed gratification and those types of things, in addition to executive functioning and manipulating multiple types of information, happens more in the 20s. And then in terms of cognitive decline, what we do know is that people who continue to acquire knowledge often have a delay in the loss of knowledge.
So it's sort of like use it or lose it.
Exactly. And the more you put into your brain development, the more is there for you to have, like money in the bank, so to speak.
Well, that's good news.
Yes.
And you mentioned cognitive development. So cognition is a word that we'll use a lot today. Can you just give us a brief explanation of what cognition is?
Yes. So cognition basically involves many types of brain functioning. So we include in that things like visual spatial ability, abstract thinking, pure memory, calculation, reading, repetition, orientation, all of those types of things.
And one of the things that I thought was interesting that I learned is that the brain never stops changing, but it's constantly in motion. And so some of the things that we've learned that, as you were talking about, acquiring knowledge and just keeps feeding the bank, are there things that we do that don't promote brain health?
Things that are detrimental to the brain, definitely. So when we think about brain health, we want to think about healthy living equals healthy brain. So when we are not taking care of ourselves, and oftentimes that means not eating the proper foods, we want to think about a plant-forward Mediterranean diet. We can start to develop difficulties with our brain not functioning as well because we don't have the nutrients that we need. If people have other medical conditions, like they have diabetes or cardiac disease, and those aren't well maintained, it can affect blood flow to the brain, blood sugar levels, which can affect brain functioning as well. And then in addition to that, people who aren't sleeping, people who are under high amounts of stress, people who don't drink enough water and who are dehydrated, all of those things can make the brain work less efficiently, and people can notice a difference in their quickness of their thinking, for example, their memory.
How do you tell the difference between, oh, that's just normal aging, or this is something more serious that I should probably have checked out?
Great question. A lot of times people start noticing that they're not doing as well when they can't perform at the level that they were. For example, at work is where people usually recognize it first. So, for example, you used to remember every meeting that you had to go to, and now you have to write everything down, otherwise you can't remember. You used to go to the meeting and everything that was said you would be able to remember. Now you have to write things down. Those areas are often the things that bring people themselves to the doctor's office. Is there something going on? Is this becoming a problem? And if it is impacting their functioning at work, we try and tease out what's going on and give them tips to try and improve those things. So it is possible to slow progression of decline. Just like you take your car in for an oil change, you can take your brain into the neurologist for a tune-up. And we like to give people hope. Sometimes people don't understand and realize that, oh, my vitamin D level has gotten low. That can impact my brain function. So if you see the doctor, they can check those things out for you.
It's interesting because, I think many people think, well, there's nothing I can do about it. I'm just getting older and this is just going to happen. But there are things you can do to push it off a little, stall.
Exactly. There are many things you can do. So we talked about a few of them in terms of healthy lifestyle. The other thing is, just like if you're starting to have problems with your back and you go to physical therapy, you can go to brain therapy as well. So you're starting to have trouble in terms of remembering people's names. There's specific types of techniques that we can give people for that. Speech therapists actually often can do cognitive therapy as well, where they can help to retrain us in many ways in terms of our memory, the speed of our thinking, our organization. So we work closely with them.
When many of us think about decline, we think of worst case scenario, dementia, Alzheimer's. And so if you could explain a little bit about that and the difference, I learned this recently, that dementia and Alzheimer's are two different things. So if you could explain the difference.
So dementia is an umbrella term that refers to cognitive issues that are starting to affect daily life. And it may be related to a number of different factors. One of those factors is Alzheimer's disease, which is a neurodegenerative disease which causes changes in the brain. And those changes are happening and they seem to be associated with worsening functioning of the brain. Whether or not they're caused by an underlying process, which we still do not clearly understand, or they're the brain's mechanism to try and slow down that process. So people can inherit a gene called ApoE, and ApoE4 is associated with higher risk. We inherit one gene from each parent. And so people who have one gene, ApoE4, have a percentage higher, and 2 is even higher than that. And then there are many other causes of dementia. So when we see a neurologist, a brain doctor, our job is to determine, number one, is there a problem? Where is the problem in the brain? And what is the underlying cause? Certain people have more than one thing affecting them. And so once we can determine what the underlying issue is, we can work diligently to try and either slow progression or reverse in some cases.
Is there any way to reverse dementia, or is it really just managing it?
Well, it's a great question. There likely is a way to reverse it, which we have not yet fully discovered. So current treatments are looking at slowing progression, but the newer treatments are looking to try and decrease this burden, particularly around Alzheimer's disease. And prevention is one of the big keys as well.
And if it's genetic, can it be reversed?
So there are nature versus nurture components. So people can have genes, 1 or 2 of the ApoE, and still not develop dementia. So some of it has to do with the environment. Some people can have one problem and have more rapid progressions. And so the more we can do in our daily lives to change our lifestyle to actually improve our cognitive reserve and, improve our brain functioning and improve our nutrients to our brain, those things can make a big difference and people can turn things around.
And in keeping with how to manage something like dementia or Alzheimer's, and then just having a healthy brain. Well, you had touched on a lot of it. Can we just go through a little bit? Like, one thing that annoyed me was that they say doing crossword puzzles doesn't really help. It helps you get better at crossword puzzles. And I do crossword puzzles, so I was a little annoyed to hear that.
Well, I think it's a great question. And so what we do know is that certain areas that we're testing are reinforced by specific exercises,
Mm.
right? So in shifting sets, we know that when people have to change their pattern and they are able to adapt to that, that's a good practice test for that. Visual spatial, it's drawing three-dimensional objects, which helps with that. Other types of training in terms of serial subtraction and things like that, those things people think Sudoku and other math problems and
Mhm.
puzzles can be helpful for. Reading out loud is actually very helpful. So, for example, when you're reading out loud, and I've talked a lot about this lately, what you're doing is you're speaking, okay? And so that helps with your articulation. You're improving your auditory processing, which is the ear to brain connectivity, which actually slows down considerably in many people as we age. And you would be so surprised to know that wearing your hearing aids actually will improve your cognition. And so many people don't do that. And so the first thing I do when I'm testing somebody and they're struggling, I do their hearing testing beforehand. So wearing your hearing aids, reading out loud so your auditory processing improves, really also that's an active form of reading and it actually helps you retain much better as well. So I talk to patients about 30 minutes of reading out loud every day, and people get into it, and it does make a difference in terms of their cognitive functioning. So that's a little hot tip for your listeners.
Yeah.
In addition to that, different forms of reading can be helpful as well. So I tell people when they're watching a movie to turn on closed caption because you're reading along with the movie. You're actually getting so much more detail from the movie. You're actually retaining quite a bit more of what you watched as well.
Mhm.
And then you can discuss it with your loved ones, family, and friends afterwards. So it keeps you more engaged as well. The
Mhm.
more you can do to engage. I believe that crossword puzzles are helpful.
Well, thank you.
You're welcome. And because it requires you to pull out pieces of memory. Some of the things that we like to think about in terms of holistic lifestyle, too, are thinking about how things were before the internet. So, what are the things that you can do in your daily life to improve your cognition? Think about eating healthy and cooking your own food. Think about long, leisurely meals where you're not rushing and trying to eat a lot of processed foods. Thinking about taking walks after dinner or in between your meals. And then in addition to that, reducing your screen time. And some people have coined the term nona maxing, which is basically being like an Italian grandma. And so living that type of lifestyle has so many positive impacts on your cognition. Also, you're out socializing when you're on your walk and you're going to the grocery store. So you're interacting with the community and meeting new people. So all of that can be very positive for your cognitive functioning.
That's great. You don't need to be Italian to benefit from it.
You don't need to be Italian.
One of the things I was surprised to hear about, which made a big difference, was exercise.
Yes, a huge difference.
Mhm.
And there are a variety of different reasons for this. What we know with exercise is that in addition to improving blood flow, circulation, there are definite chemical and neurotransmitter effects that happen to the brain with exercise. We've seen this most prominently with dopamine. So, dopamine is a feel good type of neurotransmitter that helps with our physical capacity, but also helps with our cognitive speed as well. And so, in studies that have been done in people who have trouble with their dopamine levels, so Parkinson's patients, when they exercise, it actually keeps their dopamine around longer, and in some cases, can even improve dopamine levels. So, we are big fans of exercise, and the literature shows and supports this that the more you do in terms of physical activity, staying active cognitively and physically, the better off you do with your mental health
Mhm.
and your brain functioning.
And I want to ask you about socialization. I've
Mhm.
heard that that's a big thing, and what is it specifically that that does to keep the brain healthy?
So, serotonin is another mood chemical. Humans are social creatures. So, the more we interact with others, the more neurochemical that's
Mm.
produced in terms of serotonin. And also with connecting with individuals, speaking, physically being, in the same vicinity, we basically are activating a lot of our neural circuitry as well. We're observing people who we're with. we're interacting, we're listening, we're processing that data. So it basically is increasing the data input into our system and increasing our neurotransmitter, our positive neurotransmitters as well. Now, I will say interactions that are negative can have an opposite effect. So if we're surrounding ourselves by negative people, negative situations, or putting ourselves into stress, the opposite can happen. And so I tell my patients, I said, it's not just about being around people, it's about being in situations that are positive for you and that are boosting your chemicals. So that's an important piece to think about. You want to have your cohort, your community that provides you with support, but also interacting with new situations also provides improvements in your neural network functioning. So putting yourself in different situations, maybe trying out a different coffee shop or taking a different route to work, not always the same route, it helps to improve all of the networking that's happening in your brain.
And I want to go back to one thing that you had mentioned about nutrition. You had mentioned the Mediterranean diet. And I've been hearing about a cross between the Mediterranean diet and the DASH diet for hypertension. It's called the MIND diet. Can you explain that and what the difference is?
Many of the foods are similar. So foods that are high in antioxidants, foods that have a lot of nutrient value. So we think about foods that are high in B12, D, iron are very good brain as functioning as well. Vitamin C, all of those types of vitamins can be very useful in terms of the different components and building blocks that are important in neural cell development and maintenance as well. I want to just make a quick additional plug for hydration. That's actually as important as nutrition and something that's sorely neglected, particularly in our culture. So what we find is that optimizing our hydration, and what that means is approximately 6 to 8 big glasses of water a day, will make a huge difference in terms of blood flow to the brain, kidney function, reduction in toxins in our system, and also helps, and this is a big key factor people don't realize, in terms of gut motility. The gut and the brain are very connected. If your gut's not working, you're not absorbing your nutrients properly, you're having higher levels of toxins produced most likely as well. And so being able to have a bowel movement daily, clear urine, these are very important easy things for us to master in terms of incorporating into our routine. Now, everybody stops me and says, I don't want to have to go to the bathroom, Dr. Hohler. As we get older, our bladder control becomes a challenge. And so I tell them, getting up to go to the bathroom is part of your exercise regimen, okay? We get up, we walk to the bathroom, we stretch our legs. It's part of our routine and makes a huge difference in terms of our overall sense of well-being and our ability to manage our fluids.
As we all know with nutrition, getting your nutrients from foods is the best way to do it. What about, we hear so much now about supplements, about brain supplements. Do they really work?
I think it's a very important question. What we do know is that keeping your vitamin levels at a normal or brain normal level is very important in terms of neurologic functioning. So one of the first things I do in terms of my patients who present with any type of cognitive issue is I check these vitamin levels. If their levels are borderline low or low, we supplement to get them to the brain healthy levels, which are sometimes a little higher than the normal lab values. And then in addition to that, if my patients are interested in trying some over-the-counter supplement for brain health, we look at the ingredient list, we talk about how that may or may not benefit them in terms of their other medications, etc. You should just run all of this by your provider, and they can give you some good guidance individually to help to try things out if you'd like to in a safe manner.
So speaking to your doctor is always important. We always recommend that.
Yes.
I wanted to talk about, just the other day, 2 articles came out about medications that can support a healthy brain and medications that to avoid. One of the things that I thought was very interesting was the flu vaccine and the shingles vaccine are actually good for the brain.
Well, it's a great question. What we do know is reducing infection is helpful for the brain, and any type of infection. If we can reduce viruses, if we can reduce urinary tract infections, plague our elderly patients. And so if we can reduce those, we can reduce the cognitive changes that can happen because of that.
Okay.
There are some other classes of medication. So some of the sleeping medications can
Mhm.
cause cognitive issues. Some mood medications can impact cognition, and there are a lot of older medications for bladder functioning
Hmm.
that can also affect cognition. Those, I would say, are the top contenders. We always look through the patient's medication list and try and see what we can do to reduce or eliminate medications they may be taking for other medical issues that may be causing some cognitive slowing. And some of the newer medications specifically try to reduce cognitive issues.
Hmm.
So sometimes transitioning to a newer formulation of one of those medications can make a big difference and help brighten people up cognitively.
Okay. One of the last things I wanted to talk about was stress. How do you approach with your patients working on stress relief? One of the things that I learned was that meditation helps.
So, very good question. So, stress is pervasive in
Mhm.
our day to day lives. And so, the more we can do to try and identify those things that cause us stress, number one, and trying to reduce those, maybe interactions, maybe certain things about our work,
Mhm.
maybe our commute, whatever the case may be, the more we can take charge of those as we're able to reduce those. That's always a big first step. There are a lot of stressors that we can't impact
Mhm.
necessarily because of our lives and things like that. And so, in those situations, what we want to do is help people to manage their stress. So, if we're feeling our heart racing or our anger brewing, or we feel like we're boiling over, these types of things, our cortisol levels are likely reflecting that. And cortisol has a negative impact on the body, on
Mhm.
blood vessels, on heart function, and also on the brain. So when we are in a stressful situation, things like meditation, particularly what we find is deep breathing
Mhm.
and being able to reduce our heart rate, make a huge impact because those also then help reduce our blood pressure.
Mhm.
And so we can help patients with that. There are people who are trained specifically biofeedback experts in terms of relaxation. Now there are amazing apps as well. I talk all about the
Mhm.
Calm app, CALM, and Headspace. You can do all of this on your app. And a lot of patients with neurologic issues, if we can help to train them in these types of techniques, it can have a big impact in terms of reducing the amount of flares they have in whatever disorder they have. So we talk quite a bit about all of this. It's very important.
That's great because we always talk about dealing with the whole person. So this isn't just targeting brain health. It's just holistic that it's a good pattern to get into.
Yes, and being optimized in terms of brain and body and life and hydration and also getting enough sleep is another important thing because it helps in terms of clearing out the brain and processing kind of the brain garbage we think about overnight.
That's very positive. Well, we want to thank you so much for coming to talk to us about the year of the brain. I think we've got a lot of great tips. Is there anything that you would like to leave our members with?
I think one of the most important things to think about is if you feel like you're struggling, you're not doing as well as you had been before, or even if you're not to the point where you think you can be in terms of your cognitive potential, you can visit with your neurologist, your primary care doctor can refer you, and we can come up with strategies for you and give you a specific targeted individualized plan to try and help you be all that you can be.
Hmm. That's great. Thank you so much.
My pleasure. Thank you for having me today.
Tune in later this month to our June keynote to hear Dr. Hohler discuss migraine headaches, a common neurological disorder affecting millions, and treatments that can provide real relief. For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.